We all heard about WHO. What is WHO? It is an International Health Care Agency. What is agency means? It is an organization. So in this we have a committee or administrative party, and under this members are there or any private sources are there. So the members are collecting the funds or private sources giving the funds. So by the fund they work for the particular target. So in healthcare, health promotion, health education, health legislation, they are working for it. So that is the International Healthcare Agencies. Myself Sumar, I am the student of occupational therapy. International healthcare agencies. So they are not inside the country. So they are about the world. So they their aims are focusing on the all countries in the world. In our series, we will discuss about 13 international agencies. In our video, this video, we are only discussing about the 3 international agencies. So we will discuss further agencies in further videos. So first agency, WHO, World Health Organization. It was established on 7th April 9. So headquarters of the WHO is at Geneva. So main goal of the WHO is to attainment of highest level of health to all people. So all people should have the highest level of health. So this status people having the highest level, this status people having the lowest level, that like WHO don't want. So WHO main of healthcare and prevention control of the disease are all should be in an equal way. So that is the objective of the WHO. Not only this aim, so peace and security of all nations is also the aim of the WHO. Whenever peace and security is ensured, the country should have a social health. So social health is also the aim of the WHO. Not only the physical, psychological, social health also important in our countries. So WHO aim in all countries to maintain these health. Okay, WHO is functioning now. What are all the functions? We can easily remember the functions of the WHO by A, B, C, D, E, F, G, H. So first A, all communicable disease prevention and control is the first function of the WHO. Then B, biomedical research. WHO focus on the biomedical research. C, cooperation with other organizations. So WHO is not an individual organization. So it is cooperate with other organizations to maintain the health. Then D, development of comprehensive health services. So development of the health services is the function of the WHO. Then E, environmental health. So road cleanliness, that like environmental health are function of the WHO. Then family health. So F is the family health, general information and health literature. So all people should be aware, and the literature saying some simple health tips. So also people should be aware of it. So that are the functions of the WHO. Then H for agencies. So another agency is United Nation Fund Population Agency. So UNFPA, United Nation Population Fund Agency. So it started working in 1969. Its headquarters is at New York, so in America. Though it has a United Nation, but it focuses on the worldwide. So health of the young people are focused by this agency. So young people health. So it includes pregnancy health, childbirth health, and quality family planning services or comes under the young health and contraceptive methods. So some women want to abort the pregnancy. So counseling to the persons. So educating men about the birth spacing. So what are the space between the first child and the next child. So these like young health are all focused by the UNFPA. So this agency wants worldwide young peoples are aware of the and what are all the pregnancy health and what are all the birth health, what are all the contraceptive methods and what is spacing. These awareness should be clear to the all youngsters. That is the aim of the UNFPA and human rights of the adolescents and preventing the harm, encouraging the leadership. So youngsters should be become the leadership in future. So encouraging the leadership in the youngsters are also important in the social health. So that are also focused by the UNFPA. Then third agency, UNDP, United Nations Developmental Program. So it focuses on the human development. So poverty and human development, which means the economic growth of the humans are developed here. This UNDP was established in November 22, 1965. its headquarters is at New York. So main goal of the UNDP is to reduction of the poverty and democratic governance, which means all people have a rights. So democratic governance and crisis prevention and recovery. So any crisis, any critical situations are all prevented if there any happened. So recovery from the situation and make the people in a normal economical level. So that is the main goal of the UNDP. So what are the main activities? Poverty reduction, crisis prevention and recovery, and environment and entropy. So it focuses on the environment. In road, some accidents may happen that like the health may be issue and the economical level of the people may be affected. So that environment are also maintained by the UNDP and it coordinate with the other organizations to achieve its goals. To reduce the poverty, it coordinate with the insurance policies and it coordinate with the scholarships. So that like it reduce the poverty. Okay, so that is the UNDP. In our video we watched three international healthcare agencies. In our further videos we will discuss about more 10 international healthcare agencies. So keep supporting, be proud to watch our video. Thanks for watching. Bye bye.